Hey, family, thank you so much for joining us for this edition of MedTech Emerging Minds. And I'm absolutely ecstatic to have Chelsea Luxen, the CEO of ParaNano, here to join us. Chelsea, thank you so much for joining MedTech Emerging Minds.
I'm so excited to be here. Thank you for having me.
Absolutely. Well, we've gotten a chance to get to know each other over the last year and learn a little bit about the business, but people listening aren't as lucky. So I'd love to first understand, Chelsea, tell us a little bit about your background and how you entered this wacky world of medtech that we have.
It's a great story. Not really, but I am an entrepreneur through and through. This is my third company that I have co-founded. Started straight out of college. My undergrad, I decided to go compete in a business plan competition. And it was around electrospinning and nanofibers to improve total hip implants. And we had an ability to concentrically align fibers around an implant, and we won $32,000 at the business plan competition. So, over a decade ago, it gave me the bug. I was like, I think this is what I should be doing. And, just an entrepreneur through and through. So they elected me CEO of that original company. And then I continued to spin it on. And then I founded ParaNano, utilizing nanofiber technology, but coupled with wound care application for this specific company that I'm working on now, ParaNano Wound Care. So very excited. My background is really on the driving the business forward. So, I work really closely with the scientists, the engineers, the clinicians, to make sure that the products that we are developing and spending our hard-earned capital are very, important time on is not only going to work, it's going to be scalable, and it's going to actually solve a problem, and is something that clinicians and providers and patients will gain value and use from.
Yeah, I love that because, here's so many founders who are talking about really the technology and what it can do, but really shifting that and looking, okay, what does that do for the physician? What does that really mean for the patient? Versus how really novel it is, right? And having that balance.
It's a delicate balance. We all think that our babies are beautiful, but the reality of the situation is if there's no one on the back end of things that is actually going to purchase it or use it, then baby's not that pretty. So you really have to continue to keep that pulse and that conversation going with those end users. And from the inception of the business, when we originally founded ParaNano Wound Care, what we're doing now, we have no background in wound care, but I was living in Las Vegas at the time. And the conference Wild on Wounds was in town literally that week. Mm-hmm. And so I bought myself a ticket and I went and I sat in those rooms at the conference next to clinicians and, providers. And I was just a sponge. And from that moment, from business inception, we have constantly had a pulse talking with the true end users to make sure, again, that we're not building something that's not going to be adopted.
Yeah, that's great. Well, talking about, the beautiful babies, tell us a little bit about this beautiful baby ParaNano. I'd love to understand, what it's doing, what's the problem it's solving.
Sure. So I like to start off with the problem when I'm explaining what it is that we're doing. So Medicare is spending nearly $100 billion a year on wound care. This is driven largely because of wound infections. Specifically, wounds are becoming infected, and then there's high dollar negative outcomes associated with them. Yeah. So we're seeing, antibiotic resistance, hospitalization, amputation, sepsis, mortality, horrible outcomes that are costing. It's a very heavy burden on the payer system. And so, you can segment infection into two separate categories. You have treatments. So once an infection is there, you have your treatment category, which is your silver dressings, antibiotics. We have a lot of really great tools for that. But on the other side, we noticed that there was a gap specifically on infection detection. It's widely known and understood that the earlier you can intercept an infection, the better. However, the current standard of care is clinical signs and symptoms. And when you're dealing with, compromised patient populations who are suffering typically from chronic wounds, those with comorbidities, Clinical signs and symptoms are not accurate. They're very subjective, and sometimes they don't present at all, especially on, when you're relying on those with patients with darker skin tones. And so we sat back and we thought to ourselves, oh my gosh, this is an opportunity for growth, an opportunity for us to impact an entire industry with our platform technology. So what we have built is the WoundCue. It's a nanofiber membrane that's yellow, and it goes from yellow to green in response to early pathogenic activity or heavy colonization. So we are able to provide a very distinctive color change at the earliest possible moments, indicating that there's something going on in this wound and you need to go get seen. So it's a dressing. So it doesn't go on the wound. It can remain in place for up to 3 days. And you can think of us as like a smoke detector, right? If antibiotics are a fire extinguisher of medicine, we're the smoke detector telling you, hey, there's something going on in this wound and some type of intervention needs to take place, whether that be telehealth appointment, actually going and seeing your physician, having your provider come see you, even just taking a picture and being instructed to do a wound soak. You're able to shift that up days, weeks, to have a positive impact on those costly negative outcomes.
Yeah, that's pretty powerful. And today, I mean, the wounds are, bandaged and there's no real way for a patient at home to access that. No.
Right. Well, and, unfortunately, patients are sometimes their own worst enemy, right? So if you give them a lot of complex instructions, or, they have to change their dressings, or they have to do a lot of different steps, then it's likely that those steps are not going to be followed. So when we were actually designing this, we made it not only simple and simplistic for caregivers to integrate into what they're already doing, but also on the patient side, literally all you have to do is look at it or have someone look at it. And we have a color control card, so you can compare if it's deviated from this yellow, and we've got a gradient on the back. If it's deviated at all from this yellow, then you can call your provider, because we consider that a positive color change. We're infrastructure independent as well, which was it was a very thoughtful, conscious decision on our part to not include an app or any type of connectivity or Bluetooth, anything, because we wanted this to not only be usable in the care settings where you have access to Wi-Fi, Bluetooth, things like that, but also we wanted it to be a broad range application across basically everywhere you have wounds. So we're talking austere environments for military service members, rural applications where our rural hospitals are closing. Takes them 3 to 4 hours to get to care. And depending on the infrastructure, they may or may not be able to, take a picture, or you just never know. And so everything in how we have designed this end product and our minimum viable product entering the market was very thought through and tailored with, again, the providers and the patients in mind. Yeah,
we're keeping it simple. And I imagine too, because your go-to-market is an integration into, common treatment settings, right? Common treatment bandages. Am I correct? Is that the go-to-market strategy for this?
Yeah. So we're actually packaging it in a kit. So it's going to come with like an island foam dressing and a clear film backing. And so essentially you put the foam down first. So our initial target market is going to be moderate to heavy exuding wounds. Put the foam down first. If you need to trim it, you can. You're going to take the WoundCue, apply it on top of the foam, and then you seal it with the clear backing. And so you have that nice wicking property from the foam itself to transfer the exudate to our WoundCue. But then the clear backing allows you to actually have that nice visibility. And again, that can remain in place for up to 3 days. And if you don't have a color change, then, after 3 days, you can remove and apply your next WoundCue kit. And if you do, then you call your provider and you listen to what they tell you to do from there.
Right. That's excellent. I love just the simplicity of the concept. This is the smoke detector, know, and right now there is no smoke detector. There's no way to know, something there's something burning that you need to take care of. So it's a really good analogy. Where are you guys on the pathway to having this available?
Well, we're about 6 months away, which is really exciting. So we are actually gearing up for 2 clinical studies right now. CTAs are out the door. We're negotiating, those terms with our clinical study sites and PIs. But one of them is with Wounds Care Plus and Martha Kelso. We actually went after Johnson & Johnson quick-fire challenge with the Blue Knight program, and we got this study funded, which is really exciting.
Wow.
So yeah, Martha and I, Martha is our PI, and we will be doing our initial clinical study with her into her sites. And so that's really exciting. We're hoping to get the IRB submitted and get first patients enrolled very early next year. And then we're also partnering with a local children's hospital here in Oklahoma City, which I'm also very excited about, because not only, pediatrics, it's near and dear to everyone's heart, right? But it's also really great to have someplace local, since we're in the middle of the country in Oklahoma City, that is able to roll this out in a different care setting from long-term care and, mobile wounds care, which is what Martha's doing. So I'm really excited. So again, we're planning on getting first patients enrolled by very early next year. So stay tuned for clinical data. And then from there, we'll be able to use that clinical data to update our indications for use with our FDA, and then we'll be ready to answer orders. So if anyone wants, first adopters of the WoundCue kit.
Yeah, no, I love that. And I love the strategy around that chronic mobile, population. A lot of people think about when they think of wounds, but then also having the juxtaposition of the pediatric, and those kids that are healing post-operative or different things where, they have immune systems that are going to be much more susceptible to infection. How can we, and have both of that indications, which gives you a very broad utilization of standards, essentially.
Indeed. Yes. And, it's like acute versus long-term care, right?
Yeah,
so if you're in long-term care, there's a different pathway and flow through in regards to who's actually looking at this. And it's the same with the acute. So we're going to learn a lot from these initial clinical studies. And we've got some additional studies planned in the future, larger studies around health economics, things like that. But, we're really excited to tick this box on the clinical study side with these initial studies awesome. We have planned.
That's an exciting near term. Now let's fast forward a little bit. As an entrepreneur, you have vision. So tell me, 5 years or whatever that number is out there, where do you see ParaNano? What do you see that in the marketplace? What kind of impact are you going to be having at that point?
Sure. So, we're living in the maybe not so far distant fantasy world, but I have always imagined that the WoundCue will be integrated across wounds care. So because of what we are able to detect, which I haven't quite touched on, but this is not a pH color change. We actually use a unique biomarker to trigger this color change. So we went down to the pathogen level itself. So as gram-positive, gram-negative, even some fungal strains secrete a specific biomarker, that's what we detect. So it's a broad application across.
It's really going to help with any of those false positive scenarios that you would get with a pH change.
Indeed, exactly. And again, a pH is, a host response. And so we're able to see a color change before the host response is even, really starting to kick up there. So, I have always thought that the WoundCue would be broadly integrated across the continuum of care. You can use it in your home. You can use it in a hospital setting. You can use it in a long-term care setting. You can use it in the military. So essentially anywhere that you have a wound that you're concerned about infection, which is a lot of the time, in a B2B setting, a WoundCue could be used. And so right now, we've got this kit, which is going to be for moderate to high exuding wounds, but we have future kits planned for lower, no exudate present. We've got kits planned for burn wounds, surgical site incisions, things like that, to basically say if there's anything artificial port or injury to the body, the wounds can be applied. We're also opening the door right now to strategic partnerships. So, the mega players who already have established wounds care products on the market that could benefit from integration of the WoundCue kit or, the WoundCue itself into their products. And so that's something that we've opened that door to. We've gotten some really good feedback on that. And then I think it's pretty likely, that within 5 years, ParaNano will likely be acquired or at least, merged into a larger player, which would be fine because again, we as a small company now, we have the reach that we have, but the goal is to broadly position this. So anyone that, that's a good partner that can help us with that.
That's excellent. That's excellent. And, I go back to, really no one would build a house anymore without a smoke detector, right? So why would anyone have, treat a wound without having a ParaNano and WoundCue to be able to signal the problem?
Exactly.
I can see that as an absolute, determination. And you mentioned early on this, hundreds of millions of dollars spent on treating the infection, the amputation, all the, and the money spent that we've caught earlier could be significantly reduced, not to mention the quality of life.
Exactly. We have, there's whole groups dedicated to limb salvaging and sepsis prevention and treatment. And it's like, yes, we absolutely can play in this arena, right? Because if we're able to have that color change before the sepsis has even set in, to get that treatment in place, maybe instead of a broad range antibiotic or a systemic antibiotic, you can do a sharp debridement and a topical ointment. I really believe that we're going to see a huge shift in the industry once we are able to deliver this early intervention tool.
Yeah, I can imagine that. Well, I want to shift gears. Speaking about shifting a little bit, I want to talk about, as a proclaimed serial entrepreneur, give us some advice, for other people listening to this that are entrepreneurs, want to be one. What are some of the, things you've learned as your best practice? Or maybe it's easier said, conversely, mistakes you've made. I don't know the easiest way to answer that for you, but we'd love to learn some of the lessons.
Yeah. So, one of the biggest lessons that thankfully I learned early on because of mentors, I want to say forced, but kind of forced to do the initial market research, right? So I mentioned that I went to the Wild on Wounds conference and I sat next to players, but there is a program, the NSFI core program, that literally forces you to they call it get out of the building and go talk to over 100 people in your projected space to fill out what's called this business model canvas. This whole process was created by Steve Blank. And so you do this and you go talk to your people, and then you realize, is this a viable business? Do we need to make changes? What kind of information can I glean about the industry as a whole in a very unbiased way? Because the instructions are don't tell people about what you're doing because you want their unbiased opinions on the industry as a whole. And so we did that. I actually overshot. I did about 150 interviews in that. And the reason we were even in that program was because one of my mentors, who was my first check, he said, I'll give you this check, but you have to go through this program. And I said, okay, I'll buckle up. Let's do it. And so that was probably one of the most important things that I did early days of getting ParaNano off the ground, because, it's one thing to actually go talk to people and make sure you have the pulse, but it's another thing entirely to have unbiased information about what the industry is needing. So when you ask providers, what's your main concern when you're dealing with a chronic wound, they're going to say that the patient follows my instructions and that it doesn't get infected. And, then that opens the door to, well, why doesn't the patient follow instructions? Which led us to making this as simple as possible. So, I would say a huge lesson learned for me was make sure, again, that you're keeping pulse with the industry that you're answering and making sure that you know what your end customer will truly want, and that you're being very thoughtful about how you design your end product. And then lessons learned, it's never as easy as you think it's going to be. Of course, if it was super easy, everyone would do it. It will take twice as much money and twice as long That is true. As you think it's going to. And then I would say, there's a healthy amount, I say it tongue in cheek, of delulu. But truly, as an entrepreneur, you have to continue to believe in your product.
What is
delusion?
Delusion. Ah, yeah. Okay.
But in the best way, because you have to believe in your product, you have to believe in your team, and you also are going to be confronted with so many roadblocks. Maybe your first iteration of the product doesn't work ideally. Well, now you need to think your way through how you're going to make the next version better. If you have a team member who was great in the early days, but maybe is kind of dropping the ball, you need to, it might be time to make a change and work with that team member to either better themselves or move in a different direction. So it's just a lot of excitement, a lot of uncertainty, and a lot of learning, because I don't know any entrepreneur who knows everything about everything, especially in MedTech or healthcare. So really surround yourself with good team members and know your gaps. If you have a gap, find someone who can fill that gap so you can learn from them, and then just keep the ball rolling.
Oh, that's some excellent, a ton of advice to unpack there. I love the discipline of that market survey. And what was the name of that program again? You mentioned.
So it's the NSF I-Core program. The NIH also has one, so National Science Foundation or the National Institute of Health.
Yeah.
And they each have their own version of I-Core, but it follows the same model, and you get funding. So it's like a non-dilutive grant that you get. So you have to apply for it and, go through this whole process. But
I love that, really unbiased learning to start, because, a lot of people will do that, but after the fact, and do voice a customer on a product they already developed. And your point that a lot of times will bias the jury, or you have the fallacy of sunk cost, and you don't want to really hear about the problems, right?
Exactly.
And so you do it early, that covers it. I like the aspect that you have to have that balance. What I heard you saying is you need to have that, I think Steve Jobs, that reality vortex, delusionism, but you also need to have that combined with that practicality of, this is a problem. This person that got me here won't get me there, and I also know that even though I have these dreams, I'm not good at everything. I can't be the self-limiting factor of this organization, and I need to find the people that are going to help me perpetuate that forward. That's some really good advice.
Even with raising money, funders really like that, where your gaps are too, because they know that you don't know everything. And so, regulatory, for example, or reimbursement, it would be really crazy to not have a regulatory or reimbursement team if that's something that applies to your business. So again, know your gaps. You can't know everything, and that's okay.
Yeah, that's awesome. Well, really impressive solution, really impressive business. I like the way you've thought about it, planned it. And of course, your passion is palpable for what you're doing and the impact you're going to make. So I really appreciate you coming on, sharing this with us. Now, people listening, they want to get in touch, learn more about ParaNano. How do they learn more?
Yeah, so go visit our website, paranano.com. You connect with me on LinkedIn as well, Chelsea Luxen. I'm pretty findable. And on our website, there's a little link that says contact us. So if you are interested in partnerships or any type of adoption, or even just have some ideas and you want to chat, please reach out. One of the things about us is we'll talk to just about anybody because, that's how you continue to build and learn and grow as well, is keeping those doors open. So
awesome. Well, thank you so much, Chelsea, and congratulations on getting this far. And I can't wait to have the new wound smoke detector out as standard of care in the marketplace.
Yeah, I appreciate this. Thanks so much, Joe.
Thank you.